Hello, and welcome to episode 2 of In Context. I'm Gregor Thomson, and I want to start by thanking those of you who watched, liked, shared, and subscribed after I posted episode 1. The feedback was much better than expected, so thank you very much. For this show's main topic, I thought I'd steer slightly away from the COVID crisis and speak about something new: drug policy. I know that the amount of people in favour of drug policy changes has risen rapidly, so I thought it'd be a good topic to provide some deeper context so that you can make an informed decision about where you stand on this issue. I will be honest here. This is my show, which means I don't have to follow any journalistic guidelines to be impartial, balanced, or objective. I can say literally whatever I want, but that's not the point. I don't want you to think of me who will just say anything for the sake of it. I'm telling you this because I will cover both sides of the arguments for this topic and future topics, and I will try to be objective. However, I do have my own opinions on these topics, and if these opinions show, that's fine. I may be ill-informed before I write these episodes, but I hope that when it comes to filming and after researching, I'm better informed, and hopefully after watching or listening this, you will be too. If you think I'm wrong, or have been ill-informed, you can let me know in the comments. I'm happy to be proven wrong. However, the information I provide here will be from trusted sources, and it will be what I believe to be correct. I hope you do trust that what I say has been well thought out and researched. So with that out of the way, let's start. So drug policy. It's a very broad subject, one that will need a lot of time to cover, and luckily I've got a lot of that. So let's start with a policy change that's been called for a long time: safe drug consumption rooms. The first professionally staffed drug consumption room was introduced in the Netherlands in the early 1970s. Now there's more than 100 safe drug consumption rooms operating in 10 countries, including Switzerland, Germany, the Netherlands, Norway, France, Luxembourg, Spain, Denmark, Australia, and Canada. So what are these safe drug consumption rooms? They're legally sanctioned facilities where people can inject their own pre-obtained drugs under medical supervision with sterile injection equipment, a hygienic space to use drugs under medical supervision with emergency care in the event of overdose, counselling services, and referrals to social and healthcare services which can offer a gateway to drug treatment. But are they effective? Well, this study showed they provide conditions, especially for regular clients, that do improve hygiene and reduce exposure to health risks such as infectious disease or overdose, and there's no evidence they increase levels of drug use or risky patterns of consumption. So this all sounds like a no-brainer, but are there any drawbacks? Well, that depends on your viewpoint and your priorities. The main one is money. Most people don't want to fund someone else's drug use, and for good reason. Safe injection sites cost money, and a lot of it, which can be a huge negative factor, especially in poor areas. However, current safe injection sites actually operate at a net positive, with Vancouver's safe injection site actually saving the city an estimated $6 million in medical and emergency costs each year after the cost of the facility. So why haven't they been introduced in Scotland, where we have the most amount of drug-related deaths per capita in Europe? For over 5 years, public health bodies like the NHS have been outlining the horrifying rise of HIV cases and overdose deaths, and have been recommending safe drug consumption rooms to combat this. Since the idea of safe drug consumption rooms in Scotland was first spoken about, campaigners, charities and experts have been calling for a safe drug consumption room in Glasgow. This man, Peter Crykent, a community activist, is even risking arrest to set up a safe injection facility in the back of a van for addicts in Glasgow in a desperate attempt to break the political deadlock around drug consumption rooms. So why has it come to this man setting up an illegal injection facility? Well, frontline workers say that politicians just haven't grasped the severity of the situation. Since then, various party MPs have backed these calls via a letter to the Home Office by the All-Party Parliamentary Group for Drug Policy Reform, which includes MPs from SNP, Lib Dems, Labour and the Conservatives, urging the Home Office to sanction safe drug consumption rooms in Glasgow. That was last year, and the Home Office said there was no plans to open safe drug consumption rooms. More locally here in Scotland, the Scottish Affairs Committee launched an inquiry into the drivers behind drug use in April 2019, which I attended. And I'll be honest, while I was impressed by what was said, there was so much talk of radical change and the like, but realistically I didn't expect much to come from this. It was led by a group of MPs who heard evidence from organisations and individuals on a range of questions, including identifying the unique drivers of drug use in Scotland and the link between poverty and drugs. The committee published its findings in November last year. They went multiple steps further than safe drug consumption rooms. While they did recommend the introduction of these rooms, they also recommended that the UK government adopt a public health approach to drugs and transfer lead responsibility for drug policy from the Home Office to the Department for Health and Social Care. They also recommended that the UK government commit to decriminalising the possession of small amounts of drugs for personal use. And lastly, while they criticise the UK government's handling of this crisis, they also criticise the Scottish government, stating, "The Scottish government is responsible for health delivery and there's undoubtedly more it could do within existing powers to address problem drug use. We believe the Scottish government should improve its response to problem drug use in areas that are already devolved, and funding for drug-related health services in Scotland must be protected." So after all that, why hasn't there been at least the sanctions to introduce safe drug consumption rooms in Glasgow? The simple answer is the UK government and Home Office have refused on multiple occasions to answer calls to open these potentially life-saving clinics. Now, I want to talk specifically about how drug policy affects the people who deal with addiction, as well as those who help those in need of support.